All right, let's talk about a word we all think we know, arthritis. But I'm going to bet it's way more complicated than you probably realize. So let's just dive right in and demystify this thing. You know that ache you get in your knee or your fingers? It's so easy to just write it off as, oh, I'm just getting older. But what if that's not the whole story? What if it's your body trying to tell you something much more specific is going on? That's exactly what we're going to dig into. Okay, so here's the first big myth we need to bust right off the bat. Arthritis is not one single disease. Not even close. It's actually this huge umbrella term that covers, get this, over 100 different conditions. So stop thinking of it as a single thing and start thinking of it as a whole category of joint problems. Now, 100+ conditions, that's a lot to wrap your head around, right? So to make sense of it all, we're going to zero in on the two main suspects, the two big players. If you can get a handle on these two, you'll have a really solid foundation for understanding pretty much the whole arthritis picture. And here they are. Meet osteoarthritis, or OA for short, and rheumatoid arthritis. You'll hear it called RA. Now, they've both got arthritis in their name, but don't let that fool you. These two are completely different beasts, almost like they're from different families entirely. And this lays it out perfectly. On one side, you've got osteoarthritis. Think of this as a wear and tear problem. It's mechanical. It's like the cartilage in your joint is the cushion, and over time, it just starts to wear down. But then, on the other side, you have rheumatoid arthritis. This is a whole different ballgame. It's an internal attack. This is where your own immune system gets confused, goes rogue, and starts attacking the healthy lining of your joints. One is a mechanical problem, the other is an immune system problem. See the difference? It's huge. And wow, take a look at this. This is what that internal attack can actually look like. That inflammation from RA, it's not just something you feel. It's something you can see. It causes this incredible swelling, and if it's not managed, it can actually change the shape of the joint over time. Okay, so if the causes are so different, how do they feel different? This is where the clues really start to add up. With OA, that wear and tear pain, it usually gets worse when you move around. Makes sense, right? But with RA, and this is wild, that inflammatory pain can sometimes feel better with a little bit of gentle activity. And morning stiffness? That's another big tell. With OA, you might be stiffer, maybe less than 30 minutes. With RA, we're talking an hour or even longer. And finally, RA tends to be symmetrical. It usually hits the same joints on both sides of your body, like both hands or both wrists. So you can see why just saying I have arthritis isn't enough. Getting the right diagnosis is absolutely critical. It's like being a detective. The doctor has to gather all these clues to figure out exactly what's going on. So how do they do it? What's in their detective toolkit for cracking this case? Well, it's not just one thing. It's a whole process. First, they'll do a physical exam, looking for swelling, seeing how well you can move. Then they'll run blood tests. These are huge because they can spot inflammation markers and even find specific antibodies, like one called anti-CCP, which is a major red flag for RA. Next up is imaging. X-rays and MRIs let them literally see inside the joint to check for damage. And sometimes, for the final piece of the puzzle, they might even take a tiny sample of fluid from the joint itself. And this little case file here just sums it all up so well. Look at the speed. OA comes on slow, over years. RA can pop up in just a few weeks or months. And the location? OA loves those big, weight-bearing joints like your knees and hips. RA tends to go for the smaller joints in your hands and wrists, and remember, symmetrically. And of course, the lab tests tell the tale. With OA, they're usually normal. With RA, you see all those signs of inflammation and those specific antibodies lighting up. Okay, so we've talked a lot about figuring out the problem. But getting a diagnosis, that's not the scary part. It's actually the opposite. It's the starting line. It's the beginning of the action plan. And the good news is, the modern toolkit for managing this stuff is more powerful than it has ever been. And that right there, that is the key message. Is there a cure for most types of arthritis? Not yet. But a correct diagnosis is like getting the key to a door. It unlocks a whole world of treatments and strategies to control symptoms, stop damage in its tracks, and let you live a full, active life. So what does that action plan look like? Well, it's not just one thing. It's a multi-layered approach. It always starts with the foundation, lifestyle. Things like managing your weight and eating well to take stress off the joints. Step 2 is physical therapy, super important. Step 3, of course, is medication. This can be anything from basic anti-inflammatories all the way up to these incredible advanced biologic drugs that can actually tell the immune system to stand down in RA. And for the last resort, step 4, for joints that are really damaged, surgery like a joint replacement can be absolutely life-changing. I just want to pause on that physical therapy point for a second because it's so important and so simple. Think about it. If you build up the muscles around your knee, for example, those strong muscles act like a natural brace. They take on the load, they act as shock absorbers, and they protect the joint itself. It's a fundamental part of managing arthritis well.
All right, so we've covered the science, the diagnosis, the treatment, but let's get real for a minute. Let's talk about the human side of this, because at the end of the day, what really matters is how this affects someone's actual life.
I mean, a joint doesn't hurt in a vacuum, right? That pain in your hand, that's what stops you from opening a jar. That stiffness in your knees is what makes you think twice about taking the stairs. It literally changes how you interact with the world around you, every single day.
And this isn't just a feeling. There's hard data to back it up. Researchers have looked at this, and studies show a really significant drop in hand and finger grip strength for people with arthritis compared to those without. And a quote from one of those studies from 2021 really hits the nail on the head. It says the impairment of anatomical integrity, decreasing of grip and pin strength, and pain affect independent daily life activities. And that's the bottom line. It's not just about an achy joint. It's about being able to button your own shirt, hold a coffee cup, and live independently. That's why managing this is so much more than just managing pain. It's about preserving your life.
Okay, so let's wrap this up. What are the big takeaways here? Number 1, arthritis is not one thing, it's over 100 things. Number 2, the two biggest types, OA and RA, are totally different. One's wear and tear, the other's an internal attack. Number 3, knowing which one you have is everything. It's the key to getting the right treatment. And finally, the treatments we have today are amazing and can help you manage pain and protect those joints.
So I'll leave you with this to think about. What's one small thing, and I mean small, that you can do today to help your joints out for the long haul? Maybe it's a 5-minute walk. Maybe it's adding some turmeric to your dinner. Maybe it's just sharing what you learned here. What's that one little step you can take? Something to think about. Thanks for joining me.